First set of muscles we're going to talk about are the suboccipital group, and you can find them at the base of the cranium. There's 4 muscles on each side, and they go from the base of the cranium down to the second cervical vertebrae. The suboccipitals are often big players in tension headaches, cervical pain, even pressure behind the eye. One thing to remember, the suboccipital muscles work closely with the masseter muscles. Your masseter muscles are your primary chewing muscles located right here on the mandible. They attach to the zygomatic arch, they come down and insert underneath this mandible. So oftentimes the masseter muscle and the suboccipital group need to be treated together because when they're activated, one is usually involved as well too. Trigger points of the masseter can give you jaw pain, earache, tooth sensitivity, and also contribute to pain underneath the eyes. I'm going to show you a couple different ways to treat the suboccipital muscles. The first one we'll talk about is with a tennis ball. I'm going to cup the ball with my hand, support it with my other hand, and I'm going to work the back of that cranial base area until I find something that I feel needs to be worked. Now remember, nothing sharp ever goes back here. You don't want to use a theracane. You could probably use your fingers if you wanted to, but I prefer something softer like a tennis ball and a little bit broader. And you're going to find something, and when you do find it, remember it's about 60 seconds per sore spot. You're going to relax into it, kind of let it release. Another option is to use a yoga block if you don't want to use your hands to support the ball or if it bothers your shoulder. In this example, I've got 2 tennis balls taped together. This is my preferred choice of treating my suboccipital muscles. And I come through here. When there's 2 balls, it's less likely to sneak out, and then I can move my head around until I find that spot. Oftentimes, if you suffer from headaches, you'll get to a certain spot, and that will radiate or reproduce the symptoms of your headache, and that's okay because you know you're in the right place. Once again, 60 seconds to a minute per sore spot. Once you've got a lot of the soreness out from that cranial base, a great way to prevent that from returning is to really watch your posture. A simple exercise you can do is something I call chin tucks. And the idea is we're trying to open up that cranial base. It's the opposite of being in that forward head posture. So when you're computering, working on things, really make sure you're not in that forward head posture. So you want to bring that chin back as far as you can, make double chins, slightly even tuck your chin. You may even feel a little bit of a stretch back there, and then release it just a little bit with your scapula in the back pocket. And this is really the posture that you should be in, and avoid that forward head posture, which once again locks in this area here and contributes to those suboccipital trigger points. We want to make sure that we also massage the masseter muscle. Remember, suboccipital muscles and the masseter muscles tend to work together, so we always have to address both. A simple way to do it is literally with the pads of your fingers. Find that zygomatic arch, drop down, and then you can just feel the meat of that muscle. If you're not sure if you're in the muscle, bite down and you'll feel that muscle pop out into your hands. And you can just sit here and massage that muscle. Once again, find the sore spots, especially right by this ear. You're going to find some sore spots. Another way to work that masseter is with your yoga block and the lacrosse ball. And I'm just going to lean a little bit on here and move around until I find that sore spot on the jaw. It's another way of working it. Some people like to do it this way. It saves the fingertips a little bit. Same concept. Work it around until you find the sore spot. You're going to stay right there for 30 to 60 seconds. If you haven't subscribed to the channel yet, please do so, because I would love to hit 10,000 subs by the end of 2020. If you have any questions, please leave them down below.